Joining me now, California Democratic Congresswoman Barbara Lee. Congresswoman, thanks for being with us. Is the administration doing enough? Where's the public campaign to persuade Black people, Latino people, other communities of color who have been experimented on in the past, going back to slavery, by the medical establishment with, no information, no warnings, and no control over themselves, their lives? Where's the public service campaign to overcome their skepticism?
Andrew, nice to be with you, and thank you for the question. The administration is not doing a thing to address, one, racism in the public health system, but two, helping us target resources to medically underserved communities, Black and brown communities, which have been disproportionately hit by this deadly virus. A couple of things I'd just like to share. One is I introduced the COVID Community Cares Act. We introduced that with the Black Caucus, Hispanic Caucus, Asian Pacific American Caucus, and our Native American women. We put that bill in, and we have provisions in the HEROES Act to target resources to our communities, but also to make sure that the resources go to faith-based organizations, nonprofit, and to hire and train trusted messengers to deliver these public health messages. Because in put in historical context, there's a reason to be skeptical with regard to anything that the federal government embarks upon, especially this administration.
And we should note that the irony of this is that a Black woman, Dr. Kizzmekia Corbett, is the lead scientist behind the Moderna vaccine, working at NIH. So it would be helpful, to see her more frequently. She has been at Dr. Fauci's side with the president, I believe, at one of the photo opportunities, to have people like that, people who look like the community, on the front line for the vaccine rollout.
Yes, Andrew, she's a phenomenal, brilliant African-American woman, and I'm so proud of her, first of all, and I think that we recognize the fact that she is a trusted messenger. As we speak, let me mention that we're working with Senator Warren and the senators to try to put provisions in this stimulus package that would once again target the resources so that we can have trusted messengers from our community to deliver these public health messages. Because the Tuskegee experiment, using experimental medications and surgeries on Black and brown people, is part of the history of racism in the public health system. So this is a tall order, because all of us who are people of color, who are African American, understand this deeply, and we've got to make sure that the resources are there to put the messages out so that we can save lives and move forward.
Are any of the provisions targeting that you had in the HEROES Act, which never passed because the Senate wouldn't take it up, any of those provisions in the compromise bill that is now the centerpiece of potential breakthrough?
We're trying now, and Senator Warren has been such a champion in the Senate to help us try to get it. I believe right now there's about $15 billion or $16 billion in this new negotiation, in this new stimulus bill. So we're trying to put the exact provisions that we had in the HEROES bill as it relates to targeting the funding in terms of vaccine testing, tracing, and delivering of the public health messages through nonprofits and faith-based groups using trusted messages. Those are the provisions that we put into the HEROES Act that we're trying to negotiate as we speak into this next stimulus bill.
Well, stay in touch with us on any progress. Congresswoman Lee, it's always great to see you. Thank you very much.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.